Well, we know that most patients start out with the relapsing remitting stage of the disease. I think we have a pretty good handle on what causes that. It's these inflammatory, demyelinating lesions in the white matter. We do a pretty good job of suppressing or slowing those down with current anti-inflammatory therapies. There's 13 or 14 of them on the market now, but we don't stop the disease. This relapsing remitting stage of the disease declines, and then patients enter a stage of the disease where neurological decline is continuous and irreversible. There are no therapies for progressive MS. And so now I think the field feels that we need to really focus on progressive MS, try to identify the pathogenesis of that, what's really going on in the brain, and are there therapeutic targets that we could alter and develop a combination of therapies that would include anti-inflammatory as well as maybe neuroprotective therapies to stop neurodegeneration in the progressive MS brain. I think the relapse and remitting form, there are very good readouts of that. There's relapses, so you have clinical disability. I mean, that's what brings the patient into the clinician's office. We can do brain imaging studies of the relapse and remitting patient and see, well, they have a relapse, they usually have a new lesion in their brain white matter. So we've got a pretty good handle on that pathogenesis, and that's why we have these 13 therapies for treating it. We don't have a handle on the progressive stage of the disease. You know, you can use disability as a readout, and of course we do, but that's not quick. It's slow usually, if you look across all the patients. And so what we need is some surrogate markers that will allow us to measure the rate of disability in progressive MS, and then the hopes are we're going to get a therapy that's going to slow that. Well, that would be nice if that happens, you know, I think to look at the more aggressive ones that are more successful, I think that would be a great experiment. I think I'm not a clinician, so I have no personal experience, but I think the consensus is that these drugs are slowing down the disease, but they're not stopping it. Let's hope we find one that would stop it, right? I mean, but let's say we don't, then we better focus on what the mechanisms of neurodegeneration are in the progressive stage of the disease and try to slow that down. I mean, we're now in the point of trying to develop animal models for progressive MS. That's another point. We have a lot of animal models for relapse and remitting, very few for progressive. So we need that, and we need to identify the mechanisms by which the brain is degenerating in progressive MS. And so there's a huge focus on axonal degeneration in MS, huge focus on cortical pathology in MS. And so hopefully in the next 10 years we're going to see identifying targets and then identifying therapies that are going to slow the progression of the neurodegeneration in MS. So what's the goal? The goal is if you could combine an anti-inflammatory therapy and a neuroprotective therapy, could you at least keep the patient out of the wheelchair if you got them early? And I think if we could achieve that goal, that would be a huge impact on quality of life of MS patients.